welcome to a very special segment, Doctors on Call. Today, we will talk about a problem that is known to be one of the most common causes of disability all over the world, and that is migraines. I'm Dr. Sameer Gupta.
And I'm Dr. Sonia Lal Gupta. In my practice, both in India and America, I came across patients who would suffer from headaches every single day for many years. And the sad part is that these people thought that these headaches were a part of their daily life. First things first, having a headache is not normal, and a migraine is more than just a headache. A migraine typically has 4 stages. The first stage is called a prodrome. In this stage, even before your headache starts, you might get a warning where you know that you are going to have a headache. It could be feeling tired, yawning, and even feeling more energetic right before the attack starts. The next stage is the aura. In this stage, people usually see rainbow-like colors of flashing light. You can also get a blind spot. This is before the headache starts and can last for up to an hour. Some people can get numbness in their arms or even have trouble speaking. But not everyone gets an aura. In fact, only 30% of people actually get auras. The next stage is the headache stage. In this stage, the headache can be one-sided or even on both sides of the head. It is a throbbing headache, almost like someone is pounding into your head. With this headache, you can usually have nausea and also have vomiting sometimes. You are sensitive to light as well as noise. All you want to do is lie in a dark room with your eyes closed. This headache can last for a few hours to up to 3 days at times. The last stage is called the postdrome. In this stage, even after the headache is gone, you are exhausted and tired, and it can take up to a day for you to recover. So, if someone has a full-blown attack, at least a day to up to 4 days can be affected. Now, a lot of people ask me, why and how does a migraine happen? In simple terms, this happens because of imbalance of chemicals in the brain. One of the chemicals is serotonin, which is important in regulating the pain.
Now, in our brain is an area called the trigeminal neurovascular system. When there is a trigger to the brain in the form of stress, this stimulates this area, causing a fall in serotonin, and releases other chemicals called neuropeptides, which then travel to the coverings of your brain, causing pain. Now, if you suffer from migraines, it is important to know what triggers can cause you to have an attack. Some common triggers are stress, lack of sleep, missing meals, bright lights, and hormonal changes in women, especially around their periods. All of them can lead to migraines. Now, there are some food items as well that can cause migraines and can vary from person to person. But the more common ones are chocolate, cheese, monosodium glutamate, or Ajinomoto. Migraineurs should also be aware of how much caffeine they consume in a day. Up to 200 milligrams or 2 regular cups of tea or coffee in a day are fine. It is important to remember that migraine is not a life-threatening disease, but it can affect the quality of life of people who suffer from it.
The good news is that now there are many medications available to treat migraines. So, if you suffer from migraines, please go to your neurologist or headache specialist. See you next week.